What's the #1 question urologists get from women? It's so common you've probably already guessed it. Why do these urinary tract infections keep coming back? Yep, that's the question. Same question from 20-somethings and seniors alike and all ages in between. Nearly all women experience a UTI at some point in their lives, and for some women, they go through periods of time where they keep coming back, often every 4 to 6 months. It doesn't matter how strong you are, a recurrent UTI can disrupt your life in so many ways. Now, unless you're part of the tiny minority who've never had a UTI, then most likely you know some or all of these symptoms well. It often starts off with increased urgency and frequency to pee. Then when you go, you can't barely pass any urine, nothing comes out. Next comes that intense burning sensation when you pee. It's like stabbing knives. Your urine might also be cloudy, blood-tinged even, and usually it will have a strong odor. And it gets worse. You may feel pain in your back, in your bladder, your lower back is sore, it's just downright miserable. If you're experiencing any of these symptoms, please contact your doctor immediately. Now, the initial cause might be poor hygiene, such as wiping the wrong way, or it can be from sex, even the type of birth control you're using, such as using a diaphragm or spermicide. Holding a full bladder too long, or a dozen other things can cause it. And in older women, UTIs can often be tied to other bladder or kidney issues. There are many ways pathogens and other bad bacteria can get into your urinary tract and cause infections. However, you may take some comfort in knowing that recurrent UTIs are not usually the result of anything you've done at all. You didn't bring this on yourself. Fact is, some women are simply more prone to UTIs. If any of this describes you, then keep watching, because there is light at the end of the tunnel when it comes to UTI prevention that doesn't involve drugs. The fact is that when it comes to UTIs, many women often end up with what's known as the antibiotic carousel. And because of that, there's been a serious rise in the number of drug-resistant urinary tract infections out there. Very scary stuff, but that's a whole other video. The solution here is obvious: prevention. But can we really do things to help prevent UTIs without drugs? Happily, in many cases, the answer is yes. Today, there are a number of clinically studied natural ingredients that work with your body to help prevent UTIs. Here are the top ones to look for in order of importance. Okay, first thing you need to know about UTI prevention is that it is directly tied to the health of your urogenital flora. Yes, you have a lot of bacteria down there, both good and bad. And that bacteria should be predominantly, almost entirely in fact, made up of certain strains of a healthy probiotic bacteria called lactobacilli. It's these probiotics that push out uropathogens like E. coli, which is responsible for over 95% of all UTIs. This is your #1 source of protection, and it won't let you down. You need a daily supplement with multiple strains of targeted urogenital lactobacilli probiotics. These are different than probiotics you might take for gut health. They must be targeted urogenital probiotics. I'll show you my favorite, the one I recommend, in just a moment. Next up is cranberry. You've probably heard of drinking cranberry juice for UTI prevention, but I don't advise it. First off, it's usually loaded with sugar, and quite frankly, it's not potent enough. You'd have to drink a lot of it to get the protection you need. What I'm talking about here is a concentrated, full-spectrum cranberry extract called Pacran. Pacran has been clinically proven to reduce the rate of UTIs by directly reducing E. coli levels. Then there's garlic extract. Garlic has antimicrobial properties that help block the growth of bad bacteria, among a lot of other great benefits. And lastly, combining all of these with vitamin C, which helps keep your urine naturally acidic and has also been shown to be a powerful combination for supporting your urinary tract health. I know it sounds like a lot, but fortunately, you don't have to search out all of these ingredients individually on your own. You get them all in one supplement called V-Best from the experts at LoveBug Women's Health. It's the one I use and recommend to my patients because it's hands down the most complete daily supplement for achieving and maintaining optimal urinary tract health, with clinical support to prove it. a must daily supplement for women of all ages. You can read more about the best and get my personal top UTI prevention tips by clicking on the link below. There's only one way to break the cycle of recurrent UTIs. Just click below to get started, including a special offer today on the best. Just click the link below. I hope you found this video useful. Please look out for other videos in my series on women's health. This is Dr. Jennifer Berman. Thanks for watching.